So we have finished all the topics of discussion, and now in the end I want to revise images for you. We have done the images along with the topics as well. In the end I just want to revise images for you, and if any we have missed, we can see it here. So let us start our revision of images with the first image, that is anesthesia machine. Well, you can see this is our anesthesia machine. Okay, this is our anesthesia machine. Now what question can be asked in this anesthesia machine? Guys, they can give you a part of machine and they can ask you to recognize it, right? So I have told you all the three parts of the machine. I had shown all the parts, and I had told you that which part comes under high pressure, intermediate pressure, low pressure. So if you see, this is front of machine. Most of the things which you are seeing comes under low pressure system. Starting with this vaporizer, this flow meters, this common gas outlet, this, that is emergency oxygen flush, is present in low pressure system but has a pressure of intermediate pressure system, which we have studied when we were discussing anesthesia machine. So just they can ask you the part of machine, they can ask you to recognize the part of machine. Okay, then this image is the image of a vaporizer, three vaporizers. The first one is this Tech 6 vaporizer of DES with blue color code. The middle one is purple color isoflurane vaporizer, and the third one is yellow color, that is sevoflurane vaporizer. They can give you image of any vaporizer with the color coding in it, and they can ask you to recognize what this is vaporizer of which inhalational anesthetic agent. So we have to remember the color coding. What was the color coding of halothane? Red. Isoflurane, purple. Sevoflurane, yellow. Desflurane, blue, right? And the fluorine is not in clinical use. It had orange color code. Okay. Now, these are airways of our patient. This is Goodell airway. This is Goodell airway, which is used if there is a tongue fall and any respiratory obstruction. So we use this oropharyngeal airway or Goodell airway. We call it oropharyngeal airway or Goodell airway. Goodell airway. Okay. This is used in airway obstruction to lift the tongue out of our glottis. Now this above one is armored tube and the below one is a standard endotracheal tube. When we were discussing endotracheal tube, I showed you a real one and I showed you all the parts of endotracheal tube, which let us revise very fast from proximal to distal. The proximal end is B-welt, then we have Murphy's eye, then we have cuff, we have two black mark, then 2 centimeter gradation, and this is the universal connector. Okay, this armored tube, how to recognize it? Just one thing, difference from our normal standard tube. The inner diameter is reinforced by a metallic wire to make it kink resistant. Then this is a laryngoscope, Macintosh laryngoscope. This is Macintosh laryngoscope, right? This Macintosh laryngoscope is curved blade. Well, if you have a laryngoscope with straight blade, then this is Miller's laryngoscope. Miller's laryngoscope, and this is what we use in a pediatric patient. So Miller's laryngoscope we use in pediatric patient. Macintosh laryngoscope we use in a adult patient. So this is curved blade, this is straight blade. Okay, this is laryngeal mask airway, a classical LMA. This is classical laryngeal mask airway. Well, I told you the parts. This is the tip which rests in hypopharynx, not on glottic opening. This is the cuff, and this is the dorsum with a opening in it which corresponds to the glottic opening. Then this is the tube, fine, of the laryngeal mask airway. These are the steps of LMA insertion. I don't think question will be asked. Now see these four types of LMA. This is LMA classic, which we just now discussed. This is LMA flexible. Only the flexometallic tube has been attached to the cuff of LMA, just again to make the tube kink resistant when I have to put in such vulnerable position where there is a chance that tube can get bent. Then this is another element, this is called intubating element. This is a special element which is inserted and through which we can insert a endotracheal tube, right? So this is a special element which makes a track for ET tube insertion. This is called intubating or fast track element. This is LMA ProSeal, which we discussed, PLMA or LMA ProSeal, which we discussed in detail when we were discussing the airway devices, that it has 2 cuffs, 2 opening, 2 tubes, right? This is uncuffed tube used in pediatric less than 6 years to prevent subglottic edema, right? This is uncuffed tube, doesn't have a cuff, okay, which was present in adult tube, okay. Then this is a double lumen tube used for thoracic surgery, right? One lumen remains in trachea, another goes into one of the bronchus. When we want to separate one lung from another, we put this tube, and the right placement of this tube is always confirmed by fiber optic bronchoscopy. So the right placement is confirmed by fiber optic bronchoscopy, okay. This is RAE tube, we discussed about it. If I have to fix the tube in the middle of lip, I put this RAE tube. This is specially used for what type of surgery? Cleft lip and cleft palate surgery. Then this is a nitrous oxide cylinder, blue color cylinder. Nitrous oxide has a color coding of blue. Then Internox has color coding of blue body and white shoulder. This would be white and this would become, this is blue and this would be white. Then this is Internox. This is a oxen cylinder, black body, white shoulder. Now these are Mapleson circuits. 4 Mapleson circuit image, you have to keep it in mind, right? Mapleson A, Mapleson D, Mapleson E and Mapleson F. How to recognize them? Though we have discussed in detail, let us revise very fast. If the expiratory valve is near the patient's end, it is good for spontaneous, it is Mapleson A. If the fresh gas inlet is near the patient and expiratory valve away from the patient, then it is Mapleson D. Fresh gas inlet near the patient, good for controlled ventilation, it's Mapleson D. Mapleson E, the first pediatric circuit, semi-closed circuit, has no bag, no valve. It is inverted T-shaped circuit. Got it? And if we add in this inverted T-shaped circuit a open bag, a bag with a terminal opening, then it is Mapleson F circuit, or we call it Jackson-Reeves modification of IRs-TPs. Jackson-Reeves modification of IRs-TPs or Mapleson F circuits. Mapleson E is also called IRs-TPs. Mapleson F is also called Jackson-Reeves modification of IRs-TPs. So 4 circuits, semi-closed circuit we can be asked to recognize: Mapleson A, Mapleson D, Mapleson E and Mapleson F. Then this is circle system, right? Closed circuit, circle system, we can see the gas is moving in one, let's say, direction only, okay. It has inspiratory limb, expiratory limb, unidirectional valve, breathing bag, fresh gas inlet, soda lime canister attached to it. They can just ask you to recognize the circuit. This is BIS monitor, which we discussed about, that monitor monitors depth of anesthesia. This is a normal waveform of capno, right? We have already studied that phase 1, phase 2, phase 3, phase, and this is called phase 4. Phase 4, right? Guys, it has 2 angles also, alpha angle and this is beta angle. Alpha angle increases in any partial obstruction, right? So if there is any partial obstruction, the upsloping of the plateau will take place and alpha angle would increase. So this is a capno, normal waveform of a capno, right? This is baseline, that is dead space ventilation. Then this is dead space plus alveolar, only alveolar and inspiration, right? Okay. This is a graph of capno with severe COPD, that is partial obstruction, severe chronic obstructive pulmonary disease. This is a capno of COPD, right? Partial obstruction, upsloping of the plateau, we have already discussed. So guys, you have to remember, whenever there is upsloping, it always says partial obstruction, okay? So whether it is COPD, whether it is bronchospasm, whether it is partial obstruction of ET tube, whether the circuit has kinked, tube has kinked, Any partial obstruction, there would be upsloping of the plateau phase. Then this is the baseline has been elevated. The baseline is getting elevated. Okay. This is the graph of carbon dioxide rebreathing. CO2 rebreathing. This is a graph of carbon dioxide rebreathing. Got it? This is Mallampati score, class 1 to class 5. This they asked last time, that what is the use of Mallampati scoring. So keep the picture in view, right? They can ask you that which class is this picture of Mallampati scoring, right? So keep in mind, if all the structures are seen, class 1. If I miss 1 or 2 structure, class 2. Only hard and soft palate, 3, and only hard palate, 4. Okay. Now this is the BCLS protocol: early recognition and call for help, early CPR, early defibrillation, and post resuscitation care. This is a circle of management in a cardiac arrest patient. Now this is AED, which I was talking about, automated external defibrillator. It has 2 parts, which is simply applied on the chest of the patient, and it itself recognizes the rhythm and give a command that rhythm is shockable or non-shockable. Okay. And this last image, this is Tuhi's needle. This is the needle which we use for epidural. See, this needle has thick gauge with 1 centimeter gradation on it. This is Tuhi's needle, right? This is Tuhi's needle which we were talking about. This is Tuhi's needle which we were talking about. So it has 1 centimeter gradation on it, right, everyone? So this is all about our Tuhi's needle. Okay, and this finishes our image. This is the minimum that we have to know about the images, and if we just keep in mind these images, then mostly the images of anesthesia is covered. Okay, so thank you.